Throughout the course of the last session, the Occupational Medicine Committee have been active in exploring important issues related to both the health and well-being of the national workforce, and more specifically, the health and well-being of doctors and medical students. COVID-19 and the committee. Since the outset of the pandemic, the Occupational Medicine Committee have been to the forefront in shaping the BMA's response and advising on key areas such as the type and quality of PPE available and its provision, the need for adequate risk assessments of staff to identify those who need to shield due to high risk, adequate testing of staff, support for those tests positive, and managing their absence and return to work, the value of providing a comprehensive occupational health assessment for vulnerable staff, and promoting positive well-being in the workplace, including maintaining good mental health. On behalf of the committee, I would like to thank all those who have been working and supporting work related to the greatest public health challenge in over a century, particularly those working in occupational health. Relationship with the DVLA. We have now established a good relationship with the DVLA from which we can constructively input into their future work and guidance. The OMC have furthermore written to Dr. Nick Jenkins, the medical lead for DVLA, to ask him to encourage the DVLA and the Department for Transport to have accredited specialists in occupational medicine on the Secretary of State for Transport's honorary advisory medical panels. Correspondence with the HSE. In a similar vein, the OMC have sought assurances from the Health and Safety Executive on issues pertaining to health and safety surveillance in caring environments, and continue to have open channels of communication with their medical staff about the legal obligations and duties that need to be followed where ambiguities arise. Doctors' health and well-being. The OMC broadly welcomes Sir Simon Stevens' agreement to roll out in full the practitioner health programme across England. We are keen to ensure that all doctors can access this programme in future and that a code of conduct can be drawn up for doctors seeking help when they are the subject of a professional complaint. However, the committee continues to advocate that following on from the rollout of the practitioner health programme, there is a commitment to providing a comprehensive occupational health service for all doctors, examining all aspects of their health and well-being. We welcome the commitment in the NHS People Plan that NHS England and NHS Improvement will pilot improved occupational health support in line with the CQOS standard, along with the establishment of resilience hubs to undertake proactive outreach and assessment and coordinate referrals to appropriate treatment and support for a range of needs. OMC members have also been working with the Royal College of Anaesthetists with regard to developing a protocol for managing return to work after periods of sickness absence, and our relationships with both the Society of Occupational Medicine and Faculty of Occupational Medicine remain strong. Fit-note policy. As per BMA policy, we continue to advocate for the abolition of the fit-note, as it is an inadequate mechanism for managing work-related ill health and conditions which prevent an individual from working. We were heartened to see that the GPC have supported this by calling for the self-certification period to be extended to 2 weeks. This, as a tentative first step, is very welcome and, if implemented, would go some way to easing the burden on general practice of having to spend clinical time filling out forms. However, it is still our belief that every working person should have access to an accredited occupational medical specialist to manage sickness absence and management of their condition in the workplace. We welcome the DWP's review of the fit-note, which has been paused due to the pandemic, and look forward to working closely with them as part of their implementation partners group. Work with the GMC. While the committee welcomed the GMC Wellbeing Report, we were very disappointed that the report did not make any reference to occupational health support, which is much needed and is a very positive component of any wellbeing offer to doctors. We have also raised with the GMC Working Group the issue of lack of automatic notification to doctors when a complaint has been raised against them, and that all complaints, no matter how trivial or vexatious, remain on a registrant's record, even if it has been summarily dismissed and the doctor has not been informed. We look forward to engaging further with the GMC Working Group on this in the next session. Conclusion. As this is my last session of Chair of the Committee, I would like to thank all of the Committee for their support and hard work over the last 3 years. I wish the Committee the very best for the future, and I trust that the value it brings to the work of the BMA continues to be recognised by the Association. Of course, none of this crucial work would be possible without our Secretariat, Daniel Carey and Rosemary Hammond. Thank you both for all your hard work and unflagging support to help us achieve our aims. Thank you.